distancing. If at all possible, maybe keep a seat between you and just be careful. Okay, first, thank you for being here this evening. We just want to make sure that everyone knows our agencies have all teamed up to work together. Our county judges, Jefferson County Judge Brannick, Orange County Judge John Gauthier, Hardin County Judge Wayne McDaniel, Jasper County Judge Mark Allen, Newton County Judge Kenneth Weeks. They've all teamed together to keep their counties prepared and not panicked. They've teamed up to dedicate one hotline number for medical screenings in Jefferson County, Orange, Hardin, Jasper, and Newton counties. That hotline number will be 409-550-2536. During this national emergency, these judges are tasked with bringing medical resources to their citizens and providing necessary care to those in need. Medical resources are scarce, but they're ramping up. The county judges are working with their city and county officials, emergency management teams, and health providers to proactively combat this new virus that has changed our ways of life. We hope that by working together, we will lessen the number of citizens that are impacted by COVID-19. We are asking for the assistance of our citizens. Please stay informed. Check vetted sites like dshs.texas.gov for daily updates, because as you've noticed, the information does change daily, sometimes hourly. This is a fluid pandemic, and information will continue to change daily. Help us stop rumors that create fear and panic. I'd like to introduce Judge Jeff Brannick, Jefferson County Judge.
Well, thank you all for being here today. I want to begin this press conference by expressing my deep appreciation to the public health authorities in these several counties, as well as the City of Beaumont and City of Port Arthur, as well as the emergency management personnel and the hospitals. We've all worked collaboratively to try to come up with a plan that's going to be the easiest to understand for our respective communities, that's going to be most effective at addressing the issues that we face. And I think that we found out since probably 2008, when we experienced Hurricane Ike, that we're stronger together than we are individually. A lot of times when natural disasters like Harvey hit, we sometimes find that most of the resources are going to Harris County. And by banding together, we have a larger voice in Austin to obtain resources and to best serve our communities in the aftermath of natural disasters that are as here with a pandemic. So we've begun in the aftermath of Harvey and Imelda to work collaboratively on flood control projects, and it only makes sense that all of our close southeast Texas neighbors, a lot of whom work from these other counties in Jefferson County, it's best that we try to address this issue together and region-wide. We obviously are very committed to our communities and working collaboratively and, if necessary, around the clock as the situation rapidly changes related to the COVID-19 virus. We've got information this week that we didn't have today, and we had got information yesterday that we didn't have the day before. The Texas Department of State Health Services is rapidly changing their guidance on a number of issues like fitness facilities, child care facilities, and so forth, and we're trying to keep up with those changes in guidance. As Carol referenced, our call-in number is 409-550-2536. Whenever you call into that number, if you're experiencing symptoms, and symptoms again are fever, dry cough, difficulty with breathing, A nurse will ask you questions regarding your symptoms. If you meet the criteria for sampling after you've been screened, you'll be routed to a location for further screening and testing. Now, I'll tell you right now that we have limited quantities of sampling media that are approved for the coronavirus. Been speaking all morning to people with the hospitals and with physicians, and at best we have about 450 in the county. We all made STAR requests, which are State of Texas ASAP requests, to the state for additional tests. We also have reached out to private vendors to see whether or not we can purchase the sampling media, and if it becomes necessary for us to purchase it, we will, because we're going to take whatever steps we need to make sure that we're appropriately prepared to meet whatever happens. Some of the other counties may not have the sampling media in their counties. Those people that call into that one number for all these counties and cities may have to be directed to Jefferson County. Again, it's a fluid situation. When we are able to obtain more sampling media, locations will be opened up in those counties to serve those citizens more efficiently and with less travel time. We are asking, if you do have symptoms, that you remain isolated in your home until you have the results of your tests and receive further guidance from your health department. We ask that you not present to the emergency room unless you're in respiratory distress and are in need of emergency room services, or you're too sick to be triaged at one of the testing locations. Again, we ask that you follow several of the hygienic guidelines that have been put out on coronavirus.org, on the Department of State Health Services websites, and so forth. Those include washing your hands often with soap and water for at least 20 seconds. Hopefully it'll be hot water as opposed to cold water, especially after going to the bathroom, before eating, after blowing your nose, coughing, or sneezing. And if soap and water are not available, then use an alcohol-based hand sanitizer with at least 70% alcohol. Avoid touching your eyes, nose, mouth with unwashed hands. That's something I've found very difficult to do over the last several days. And this event has only brought to my conscience how often I do that. Avoid close contact with people who are ill. It's better to distance yourself from all events, and remain in your home as much as possible, except if what's necessary to go out and go to the grocery store or traveling to and from work. Stay at home when you're sick, obviously, and cover your coughs or sneezes with tissue and throw the tissue in the trash, and clean and disinfect frequently touched areas in your home using regular household cleaning spray or wipes. And I think most importantly, follow the emergency orders that are in place in the respective cities and counties. We will be using emergency management track software in these testing facilities so that we can appropriately report our results to the Department of State Health Services. And I just want to say, in concluding, before turning it over to Mayor Ames and then any of the other county judges or mayors who want to speak, that I want to express my deep appreciation to the people of Southeast Texas. They have been through many trials and disasters over the last 15 years. They have proven themselves to be resilient, to be cooperative, to be great neighbors, to care about each other and want to help each other. And if we continue to display that as we have in the past, we're going to get through this thing and come out stronger than we were beforehand. So, Mayor, I want to give you the opportunity to speak, say anything that you want to say. Any other county judges at the end of their discussions will be happy to take any questions that you might have.
Thank you, Judge Brannick, and you covered just about everything, and I appreciate it, and I agree with everything you said, but I would like to reiterate that we will do whatever we have to do to make sure that we have the testing mediums as we move through this. As was said earlier, this changes on a daily basis, so try not to get frustrated, because I know how easy that is, because you hear one thing and then the next day you hear something else. But this is an unknown. Like was said earlier, we've been through Harvey, we've been through Ike, we've been through Imelda, and so many other things, and this is new to all of us. So bear with us. We are learning just as fast as we can and getting the information as fast as we can. We're on conference calls very consistently and constantly with the federal government and the state, and they're giving us guidelines to go by, which I have been very impressed with so far, very cooperative with us. One thing I would like to mention is if you go to the City of Beaumont webpage on the Emergency Management Department, there is a disaster recovery worksheet. If you've experienced any loss, whether it be your business, your nonprofit, or whatever it might be, we need you to fill out that worksheet. It has also been posted on all of our Facebook pages, and we will post it again after this meeting, right, Carol? And it's called a Disaster Recovery Worksheet, and it will allow us to apply for money once we get through this to see if we can help any small businesses or nonprofits that suffer from it, because I'm sure there will be some. In addition to that, I'm hearing that it's hard to, we would much prefer then you go to the grocery store to do curbside pickup, but I recognize that sometimes when you go online to try to do that, it might be a week or longer. So we have developed in the EOC in Beaumont a coalition with the grocery stores to try to work with them to ensure that we have that availability for those of you, because it's better for their employees too, that you not go in the store but go do the curbside. So there's all kinds of things that we're working on. Just because you don't hear about it immediately, that doesn't mean we're not working on it. Like I said, things are changing rapidly, and you have some great people in our county and the surrounding counties that are working diligently on your behalf. And I also would like to take this opportunity to show my appreciation to the Southeast Texans as well, because you are very resilient. We work together, we pull together. Be kind to one another. This gets to your mental, it affects you mentally also, so remember that everyone's affected, and be kind, and let's try to work together, and we will get through this as we have before, I have no doubt. Thank you so much.
Just wanted to remind our neighbors that the grocers are working very hard to keep their shelves stocked. This is, however, unlike Harvey or Rita in that it's not just a small portion of the country that's impacted. The entire country is impacted. We have the best grocery supply chain, the best food producers in the world here in the United States, and they're able to provide that food. But when people panic and begin to hoard, that's when it creates supply chain problems. That's when others have to go without. So buy what you need for a day or two, and then check out and go home and come back a couple of days later. Let's tamp down these empty shelves that we're experiencing because of people buying way too much and way more than they need. So I want to give the other county judges and mayors an opportunity to say anything they might have.
All right, thank y'all. Orange County Judge John Gauthier. And first I wanted to thank, of course, all of our citizens that are definitely putting out a strong effort to cooperate with the orders that we've been passing down. Without that cooperation, it makes it very difficult for us to do and achieve the goals that we're trying to achieve. And I want to thank everybody for doing that. And secondly, all of my county judges that I work with and the mayors and the city managers throughout all of this, and the cooperation has been extremely great. And without that, as we move forward with a united front, which is extremely important, our citizens understand what we're trying to do and how hard and how difficult it is, but we all know the end goal is to protect our communities. And so I appreciate everybody and all the judges and everybody that I've worked with, and thank you for your leadership in that, because y'all have definitely helped me. And as we move forward with this in our restaurants and things, I would like to say something, because we know it is hard on small businesses as we move into this next phase that we're all implementing now. And that, we want you to, it's hard when we say to try to continue your life, because you need to continue your life. You need to do that, but you need to do it safely and cautiously. But if you have an option to especially when it comes to our restaurants and our small business, if you have a takeout option and stuff, if you would have went and ate there on Friday night and you can get a takeout option, please try to still support these people by doing your takeout option. It's going to be important to them, and it's going to be important to us, so that when we get through this, and we will get through this, that we have those people to go see at the end of this. And again, thank you, and thank you for everybody, and thank you to my judges. I appreciate you. Thank you.
Thank you, judges and mayors. I just want to add, I'm Wayne McDaniel, Hardin County Judge, and I want to thank all of Southeast Texas for the cooperation that everybody has displayed. To follow up on what the other judges have said about shopping, I met with all of the large grocery stores in Hardin County Tuesday morning. They all assured me that if we could go back to shopping the way we did 2 weeks ago, they could get their shelves restocked and stay stocked just like they were prior to this disaster happening. So that made me feel real good, and I want to pass that on to y'all. I know that that's easier said than done, and I understand that. They do as well. As they said before, just limit what you're purchasing. We've asked for everybody to limit 2 items of essential supplies that you're purchasing from the stores. And very important that we just be vigilant and stay the course. And I understand the governor's going to issue an executive order that we will receive sometime today. I anticipate that I will update my emergency order that will mirror what the governor is putting out. I have not read the executive order itself yet, but I've seen some news articles on that, and I do support exactly what the governor is asking for us to do. Excuse me. And we'll put that out sometime today and make it go into effect at the same time as the governor's order. Judge has given the number to you, and that number is 550-2536. That serves all of our counties, but it does not start until 8 o'clock in the morning, correct? So please don't call that number before 8 o'clock tomorrow morning. And when you call in, you will be talking to someone from the county that you live. If the calls are overwhelming, you may talk to somebody not from your county, but we're going to help you the best we can. We're praying for everyone, and I just want to thank everybody for your cooperation. And I really want to thank the judges and mayors. This came together very fast. We're very fortunate in Southeast Texas and East Texas. The working cooperation that we have, it's not that way statewide. I wish that it was. But hopefully they'll be watching us and see the example that we've set. And just know that everyone is in our prayers. A lot of people are saying they're praying for us, and we appreciate that, and we're praying for you. Thank you.
I'll be brief. I'm Mark Allen, the Jasper County Judge. I like my fellow judges, want to thank all of our mayors, all of our health departments, our health authorities, also our superintendents. I just want everybody in Southeast Texas to know that your officials care deeply about you. They work every day in and day out, trying to protect and watch over us. And it's times like these when you see their true character come out. Thank you to all of them. These superintendents care about their children, their families, and they're doing everything they can to protect them. And I want to thank once again our county judges. We've created a coalition, and we know we have a monumental task before us, but we also are going to be making a monumental effort to overcome this. We've all banded together over the years through Rita, Ike, Harvey, Imelda, and multiple other storms, and we've weathered them together. I thank you. I'm confident of what we can do to overcome this, and I thank you for your patience. On behalf of Jasper County, thank you, each and every one of you, for being here and doing your part. God bless you. We will endure.
Yes, I'm Judge Kenneth Weeks from Newton County, and I want to mirror everything our judges said and the mayor, and appreciate our understanding of people. We're going through a kind of difficult time, and we will survive. And the prayers go out to all our communities. I know we're rural in Newton County, and so if they bear with us, we're going to survive. Thank you.
Well, first, I'd like to thank God, man, for just being gracious enough to still allow us to be in this room. That's the first thing. And to thank our judges and the mayors who are here, all of our health care providers, our lead doctor here in Jefferson County, staff, Port Arthur staff. You all have done a great job. Hardin County and Chambers County, I believe that you all are working for. We've done a great job. Now, what we need to do is actually have the citizens to do what Mayor Ames just said. Just be patient. Let's be patient. This is new. not just to you, but to each one of us and to the entire community. Do what's necessary. You know, whatever the directives are from the governor's office to the county judges to the mayors, and we pass it on to you through the information that we've been given by our healthcare professionals. That's what we're having you to do. It's not anyone's personal privilege just to impose something upon you. If you're asked to congregate in groups of 10 or less, let's do that. If you're asked not to go to maybe even your place of worship in your normal capacity, there is something that's called virtual worshiping that we may want to consider. And even your giving in that, those things can be practiced. And ladies and gentlemen, from what I understand, we're in this for the long haul, and we aren't sure as to how long it's going to last. So just be patient, do the things that are right, and I bet you God is going to get us through this. Thank you.
Now, just because my emergency order has had the effect of impacting houses of worship, that doesn't mean you don't still tithe. You still got to send your check in. I also want to thank my sheriff and my district and county court at law judges in Jefferson County. They've worked very hard cooperatively to try to get the jail census numbers down. They're doing things like people who previously have been serving their sentences on weekends. They're going to stop that for a period of time until we can get through this, and so I appreciate your work, Sheriff. So now I think we want to open it up for any questions anybody might have.
Judge, there's been some talk maybe about a drive-through COVID-19 testing set up here in Jefferson County. What's the status on that?
We are going to have either drive-through or Dr. Wilkes has volunteered the county medical bus, and we will have some kind of place to where that can be set up, but and then that location may vary from day to day. We want to make sure that when these people are screened telephonically, they're given a number, they go to the testing or the sampling site, and we don't want people to just be walking up who have not been triaged. So that location will be made available to the people who call in to the center.
Any idea when?
We should have them up tomorrow morning. Now, in Jefferson County, that's not true for every county. Some of the people, if somebody calls in from Newton County that meets the triage requirements, they may be directed into Jefferson County until we can get more sampling media.
Judge, just as far as we know, one confirmed case yesterday. Since there, have you learned of any other confirmed cases? And I understand because of HIPAA laws, the privacy factor, but when you say something like Beaumont, you know, that their addresses in Gwinnett and those areas that are Beaumont, but yet they're not within Beaumont proper. So even with respect to HIPAA law, could you be more specific as far as the location of the confirmed, and again, if there have been any other confirmed?
You had to get that information if it's available from Mr. Ochnichek, and after the case was confirmed, Beaumont Public Health did the interviews with the patient, and they have that information. How much of that they can share, I'm unsure, but you know, that's the only confirmed case. There are some suspected cases, but yet to receive test results.
You described just clarify, I know guys all have questions about daycares and other businesses that remain open. Can you just describe kind of what the order of the gathering effects in terms of businesses?
The limits obviously apply to restaurants. I think if we encourage the opening of grocery stores, but ask that you maintain spacing requirements when shopping in there and distance yourself from other shoppers. The order exempts industry, the petrochemical and refining industry, as well as their associated support services, if they agree to follow CDC protocols on screening their employees as they get to work, which includes taking their temperature, making sure they don't have a fever, that they don't have the other symptoms associated with COVID-19.
I just wanted to clarify as well, just so that some on the website see if there's decent. In this Tyler County, Newton County, the people in those areas will have access to the hotline as well? In Tyler, Newton County?
We'll have what?
Had access to the hotline, just obviously on the website.
Jasper and Newton.
Jasper and Newton.
Jasper and Tyler won't be on Howard County?
Not as of right now.
What sort of costs are we looking at for people who are insured and uninsured as for if they need testing?
Pardon me?
Will there be a cost to people who are insured or uninsured for testing through the counties?
I don't think we have any plans on charging anybody anything for the testing, and I know that the federal government has said that they're going to cover the cost of the testing.
For the other area counties, I know Judge Brannick issued last night the closure of the restaurants with the exception of dine out, the closure of bars. Is that the same case in your counties as well?
Sure.
What we're doing in our counties, and, and we understood, and definitely understand Judge Brannick's direction because they did have a confirmed case. We're operating, we do not have one at this time, so we're going to follow the governor's directives and that he put out today. We're trying to confirm the date, but it looks like his directive is to start at midnight tomorrow night with that same restaurant bar and the new deal. I've got it wrote, it's ready. I think we're all kind of on the same page with that. We're just wanting to confirm the date that the governor signed his effective, and we want to follow that guideline that he put out and the CDC put out.
So, but as of right now, you still allow dine-in?
Yes, sir, as of right now in our counties and stuff. Now, I would tell you that if we got any kind of a positive test of any kind, because we have some that are out that we're still waiting on, if we got a test, we would change that upon that discovery of a positive case.
Apparently, we need to remind people that the line's not going to be active until 8 a.m. tomorrow morning because the phone's already blowing up. And
Do we have reason to believe that we're seeing community spread in Southeast Texas, or are these people who have traveled that are suspected?
I think the case that we saw yesterday was someone who had been in contact with someone who traveled. And we don't as yet have any evidence of community spread, but I anticipate that the next 48 to 96 hours will probably be pretty illuminating on what we might experience.
Speaking of that, Judge, I know just we learned yesterday from the tax assessor and her husband, the councilman, that they had gone to this League of Cities, which they weren't the only ones. There were also 3 other city officials that went on this trip. And we know of county officials that came back from some hot spots. Just this personal responsibility, I know we're asking citizens to do that. Are you aware of these folks quarantining themselves or testing themselves as far as, any of these cases? Because obviously, don't want to lead by example. Have y'all?
Yeah, I know that Ms. Getz is self-quarantined. You got to take into account how the mood in our community's changed over the last several weeks. Even I, 3.5 weeks ago, was skeptical about whether or not we needed to treat this disease any more seriously than the flu. And I studied the materials that are available and learned that it had a much higher reproductive rate, was more transmittable, had a 10 times higher mortality rate, that it impacts our elderly population much more severely. That's when I became very concerned and thought that it was appropriate and prudent that we take steps to move forward. So I think there were a lot of people that weren't concerned with travel 2 weeks ago that are concerned with it now. And that's proven true locally at the Jack Brooks Regional Airport. We normally run about 78% in 2019 for full seats on a plane. Last week it was 58%. This week it's in the mid-20s.
Judge, do you mind? I'd like to just add to something that you just said. As we start testing more and we have opened up this hotline, I don't want people to panic. I think Ms. Bain asked the question about how spread it is. We don't know, but I do think, and I think the hospitals would probably confirm this, is as we start testing more, the percentages are going to play out. And so we probably will have a spike, without a doubt. So when that happens, don't panic. Just keep doing the same things we're doing. The things we're doing will enable us to move forward and not to have as many cases. And that's what the whole idea is. If you can help save one person from contacting this disease, you could save 10. So just keep that in mind. But I just wanted everyone to know we do expect a spike. So we only have 1 case confirmed right now, but I don't expect that to stay the same. So I just want to be honest and say that, and we should expect that. If we don't, y'all can be upset with me later because I said it, but I do think we will. And but I just don't want people to panic over it, because that's when we get in trouble. Thanks.
Another thing, some of our health officials, we have a public information call every morning, and we share information not just with our emergency management teams, but with our different industries, the hospital, PIOs. We make sure we involve as many public information officers as we can. We're trying to make sure there's not confusing messages put out. One of the things that we're hearing is the medical facilities are saying, there's a lot of rumors out there saying that, well, we just didn't have tests. We had no capability of testing before all of this. We did. There was the capability to do testing. You just had to be screened first. And a lot of people think they can go through these drive-thrus. We've seen them fail in other cities where people just come from everywhere in a panic, thinking they can just drive through, do a quick swab, and in 5 minutes know if they have this virus. We have to screen people. We have to be prudent with how we use our resources. And if you could help us keep the rumors down and just remind people, we want to make sure those that we have the best information that has been affected, they are getting the care, they are getting the testing and the screening they need. So, Judge, have anything you want to add?
Carol, also, it was said at one time, why don't y'all just test everyone and we'll be done with it? It won't work that way, because you could test negative today and you could test positive in 2 days. So we test everyone, we use up our resources, but then they really don't know that they won't have it forever. In fact, we're hearing on our calls that you can contact the disease, get well, and get it again. So that is not an option.
I just went to the judge or the mayor just to follow up to Tyler's question specifically about the daycares. That seems to be the question we're all getting the most, as far as their status of remaining open. What is your recommendation, if any, to the daycares?
We started requesting guidance from the Department of State Health Services on daycare centers. We got, TDM requested that from that department. We got an email from them, and after reading through it, it was no guidance. So I know that they're saying that for areas with mild impacts that they just need to make sure they keep everything wiped down, don't allow the parents back in there, take the temperatures of the children when they're coming in, try to stay under 10. So we'll be reevaluating that as we're able to have more conversations with them.
And this might be the sheriff, but the enforcement, obviously, this came last night about the restaurants. Well, driving around, there are several, even in Jefferson County. One, for instance, there were a lot of folks in the patio of one of these restaurants that were being served. We've got information about just other restaurants in the area that are actually serving people sitting down in those restaurants. So how will this be enforced, and it can be enforced?
Well, within the cities, I would think that it'd be up to the city police departments. In the unincorporated area, it'd be up to the sheriff. And, we're hopeful that we won't have those kind of problems. Sheriff?
Yeah, so one of the things that we're already doing in the rural Jefferson County areas is if, people are notifying us, some of our neighbors are a little bit more stubborn than others. So we are trying to start off with warnings, and making sure that people understand it's about the welfare of all of our communities. And so right now, my instructions to my guys is to go notify people and warn them. There is a group of people in our community who don't watch the news and who are totally oblivious to what's going on. Y'all do understand that, right? And so right now, we're educating folks and reminding them of that. The next few days, we'll be cracking down. There is and can be a fine associated with violating the curfew up to $500 and restraining orders. And so right now, we're in the educating phase. The next few days, we'll ramp up and do some citations. And, right now, I'm trying to get people out of jail. So I don't want to necessarily put people in jail for violating those orders, but it could be an economic burden for them, because we could, up to $500 plus restraining orders, shutting them down.
And if If I could just say, within the city of Beaumont, the judge did put out, and I was texting with him while he was doing that, put out that order last night. The city of Beaumont will be putting out a new an addendum to our declaration that we've already put out, and it will include the restaurants and bars. So the ones, our police department have not monitored if they drove by because our declaration's not out, but it's actually written, and I'm going to go look at it as soon as I get finished here. And it will include that same language that the judge used in.
How about one more question?
Judge, you said it best when we have 400 test kits in Jefferson County, and the county is looking at how can we get more, we need to purchase them. So what is included in where those test kits are housed, and where are other kits in the county that weren't included?
We've spoken to a private lab, and most of the test kits are with the hospitals and healthcare facilities, or probably all of them. And in some individual physicians' offices, but there are a lot of dentists that are shutting down. I think there are some family practitioners that are shutting down to keep their staff safe, and so we're trying to find out which private physicians have those kits that might be able to lend them to the cause. We're talking to a private laboratory in San Antonio that says that they have the opportunity to get some, see if we can buy 500 of them. We've got our STAR request into the state. So we're looking at every available avenue, and immediately before this press conference started, I was on the phone with Dr. Callis, who had on the phone another company that may be able to sell us some of the test kits. So we're going to look down every available avenue to make sure that we're prepared for this.
And if I could make one more comment about that, Judge. You mentioned that their kits are mostly at the clinics and the hospitals, et cetera. Please note that the Beaumont Public Health Department is not a clinic. It's the health authority. People are expecting to go there and get tested, and that's not possible. They don't have any, that's not what they do. So I'd like to clarify that. They are the authority that they're working with us through emergency management, through the county, the cities, and also are the authority in the surrounding areas too. I'm not sure exactly which ones, but where's that? Yes, outside areas too. So, but they're not a clinic, so you cannot go to the public health department and be tested. So I think that this hotline will help that confusion as well, because once people call the hotline and they're screened, they'll be told where they can go and be tested if they do qualify. Okay?
And if there's somebody before the line opens up tomorrow that's in acute distress, respiratory distress, they can go to the emergency room. If they're not in acute distress, they can call the health authority, the Jefferson County Indigent Care, and they will give direction from there.
So even with these drive-throughs, if there's a drive-through tomorrow, you're just encouraging people to call first, the hotline.
Absolutely.
Yes.
Do not show up without a number. If you don't have the number, you will not be screened. All right, thank y'all for being here.
Thank you. And we're going to post things electronically from all the different sites, and we'll share that with you.
Carol.
Yeah, she is great. I love her.
Thank you for everything.
She is. She's a good girl. How you doing, Harold?
Good, Mayor. How are you?
I'm good. Well, we will survive.
We will survive. I
We
think
will.
we're going to be
We
there.
will.
We're going to
We
be
will.
fine. At some point.